Use firm continuous strokes, avoid cutting vital structures. Incise perpendicular to the epithelial surface. Intraoral incisions should be properly placed. Flap design. Principles of flap design help to prevent flap necrosis, flap dehiscence, flap tearing. First is preventing flap necrosis. The tip should never be wider than the base unless a major artery is present at the base. The length of a flap should be no more than twice the width in the oral cavity. The length should never exceed the width. When possible, include an axial blood supply in the base. The base should not be twisted, stretched, or grabbed with instruments that can interrupt or destroy the blood supply, feeding and draining the flap. Next one is preventing flap dehiscence. Dehiscent separations is avoided by approximate the edges over healthy bone, handling the edges gently and minimizing tension. Dehiscence exposes underlying bone leading to pain, bone loss, infection and scarring. Third is preventing flap tearing. Make incisions long enough to give adequate access. Make more than one releasing incision if more access is needing. Uh, Third is tissue handling. Apart from careful flap design and incision, technique, the careful handling of the tissue is also necessary for optimal and uncomplicated healing. Excessive crushing, pulling, extreme of temperature, desiccation and harsh chemicals damage tissues, and these should be avoided. To forceps and skin hooks are preferred to forceps that crush the wound edges. Tissue handling. Avoid excessive pulling forces to retract tissues. Use copious irrigation when drilling or cutting bone to decrease bone damage from heat. Protect soft tissue when drilling from frictional heat and direct trauma. Wounds should never be allowed to desiccate. Only physiologic substance should come in contact with living tissue. Hemostasis. Prevention of excessive blood loss is important for preserving patients' oxygen carrying capacity. Increased visibility to prevent formation of hematomas. Hemostasis means promoting wound hemostasis, assist natural clotting processes by applying pressure on a bleeding vessels or a hemostat. Use of heat, thermal coagulation, suture ligation, use of vasoconstrictive substances, epinephrine by applying procoagulants, commercial thrombin and collagen. Hemostasis, dead space management. Dead space is an area that remains devoid of tissue after wound closure. It is created by removing tissue in the depths of the wound or by not reapproximating all tissues planes during closure. These are usually filled with blood hematoma, which delays healing and predisposes to infection. Hemostasis, dead space management can be managed in four ways: suture all tissue planes, pressure dressing, packing with antibacterial medication, use of drains. Decontamination and debridement. Open wounds, external environment, oral environment, bacterial contamination, increase risk of wound infection.